Hello friends, I Dr. Singh, working as Professor and Head in Department of Pharmacology, ISF College of Pharmacy, Loga. So today I am coming with a new topic which will be very inventive because from the last number of years I am working in the Department of Pharmacology and Toxicology, and there I will discuss in brief about the basic that what is toxicology, why we do toxicokinetic analysis, and what are the various species that can be used for the toxicological analysis. So dear friends, we will initiate our lecture. Hope that you will enjoy it well. And the topic of today is basic and type of toxicokinetic studies. So that friends, you know well that whenever we initiate that we are from a branch of pharmacology. So that means this pharmacology, which is great, and it is comes from the two words that is pharm, that is drug, and ology means the study. So it is a very simple definition that you can see, and this is the study about any drug. Now here there is a need to discuss some basic that what is drug. So drug means any chemical or substance which is having a capability to produce a response. That means any substance which is having a potency as well as efficacy. So dear friends, any substance which produces efficacy, that means response in the body, and which is having a potency, the word comes from the potent. So potent means a power of a substance. Suppose I will give you example that if I will say any person can take paracetamol in case of fever. That means if anybody is suffering from fever, then 500 mg of paracetamol dose is available. But if anybody will say there is another analgesic drug which can produce antipyretic effect at 50 mg, so that means what we can say, the drug will be more potent. So if the drug will be more potent, that means it will produce a same or a more response as compared to the higher dose of drug. This is called as a potency. Now it means that potency and efficacy are the two parameters to be required to become a drug. Now see, drug can be of three types. That means drugs are of natural origin, drugs are of semi-synthetic origin, drugs are of synthetic origin. So it is very clear from this point that we always deal with the drugs which are from the three sources. This is natural. Natural means by nature, that means from the plants. So it means any drug which is available from the plant, will be a natural. Any viruses, bacteria or other organism, that means if it will be used as such, this will be called as a natural substance. So you may heard the example of ephedra. Ephedra is a plant, from where we extract ephedrine. So ephedrine is a one of the drug which can produce a adrenergic response in the body. So that means this ephedra which contain a ephedrine, and ephedrine work like a adrenaline. So on the other term you can say the natural mean from the plant. Another are semi-synthetic, that means they are not totally synthetic, but they are semi-synthetic. There is a need of little bit modification in the structure. So many of the drugs, like you can say opioid, opium is available from that, morphine, codeine, heroin, so many derivatives you can prepare, you can analyze, you can check that there is a little bit modification in the structure. Now another third type of drug they are called as a synthetic drug. That means these are the drugs which are totally synthesized, like aspirin from salicylic acid. So it is a well-known example that aspirin, which is used at different doses, like aspirin can be used at 150 mg, it can be used at 350 mg, it can be at 650 mg. So likely you can see whenever the dose will be increased, the action or the effect can differ. This can produce antiplatelet effect, this can produce analgesic effect, this could be a cardioprotective. So that means the dose of the drug sometimes if we increase the effect, additional effect could be there. So basically the department or the branch of pharmacology, it always mean work on study about the drug. So not only study about the drug, it deals with the origin of drug. It deals with the mechanism of action of drug. It deals with the drug interactions. It deals with the therapeutic effect of the drug. So that means it is that branch which deals with all the type of mechanism and drug interaction as well as therapeutic effect of the drug. So this means the pharmacology, if we want to study about the pharmacology of any drug, we should know about the pharmacokinetic and pharmacodynamic. So pharmacokinetic is further of four types, that means absorption, distribution, metabolism and excretion. And this you can say, this will be the receptor effect of drug on a receptor. So that means any receptor modulation produce a effect of drug in the body. So this means there is a direct correlation between the pharmacology as well as the pharmacokinetic. So today I will discuss with you about the toxicology, because whenever a drug goes from a subtherapeutic dose to therapeutic dose, then there is a intensity of the drug that it can increase, concentration can increase in the blood, which is called as a lethal dose. So that means whenever we will give a drug, its concentration from subtherapeutic to therapeutic to lethal, it can become lethal, and these lethal effects, they can be identified by the branch of toxicology. So that means toxicology is the branch of science which deals with the toxic effect of the drug. Likely you see that toxicology is a branch of biology, chemistry, medicine which is concerned with the adverse effect of the chemical. So that means chemical could be a toxins or a toxicants, because toxicology deals with the two mechanisms. One will be toxins and another will be toxicants. Now suppose if I will say toxin, toxin can be a snake venom. So toxin can be any of the chemical produced by any toxic insect. That means insect which is harmful for the body. Toxicants are the substance, are the chemical substance which are toxic for the body. These are the chemicals, these are the drugs, or these can be some other essential component of the, you can say, drug or any other thing which can produce a toxic effect on the body. So that means what I can say, that these are the branches which deals with the toxic effect, which are called as a adverse effect. Because three things you can see very commonly. One will be an adverse effect, another will be a side effect, and third will be an adverse events. So that means adverse effect, these are the noxious effect of the drug, harmful of the drug, effect of the drug, which could be due to the interaction of drug with the body, or which could be due to the any interaction of one drug with another drug in the body, that simultaneously lead to the adverse effect. Now see that in this toxicology branch, which deals with all the type of those substances which produce toxic or harmful effect in the body. So that's why there was a one scientist which is called as a Paracelsus. He well said that right dose differentiate a poison from remedy. So what I can say, that if you want to differentiate a drug from a poison, there is a difference of dose only. Because dear friends, I will very frankly tell you that you cannot say that normally what we eat, like sugar, like salt, like food or other vegetables, they are not toxic for us. Like sugar, sugar is also toxic if you will take a more than 4 teaspoonful daily. If you will take more than 40 grams of sugar daily in 24 hours. So that means on the other side we always says that sugar is a very safe for the body, but it is also a toxic, because he rightly said that right dose differentiate between a poison and a drug, a safe substance and a poison. So this is about the toxicology, because toxicological data, if you want to check the toxicology or toxic effect of the drug, then what we say, we should go for the toxicokinetic studies. So in the next, you can say, in the next few slides, I will discuss with you that how we do toxicokinetic studies and what are the animals which are commonly employed to check the toxicokinetic data. So this is the about the basic to the toxicology. Now what are the factors which affect the toxicology? Now it means firstly form and innate chemical activity. That means the chemical which you are using, it is of which form and innate chemical activity. What type of activity of the chemical is? So that means, suppose I will give you example that whenever we will say the drug was irritating after taking through the oral route. So what we do? We basically do that we pack the drug in the form of a granule, or either we keep the drug in the form of a capsule so that it will not directly expose toward our esophageal tract or gastric tract or gastric pH. Now another thing is the dosage form, that which type of dosage form we are selecting, because it is very important and really drastic situation that from the old time we particularly was using some capsules, tablet, but nowadays the time is changed. Nobody use capsules, tablet. Most probably we want to use, you can say, nanoforms, nanoparticles, microspheres, lipospheres. That means new dosage form we are basically using. Third point is called as exposure route, that what the route you are selecting, because a one substance can be safe to a one route and same can be toxic to the another route. So that's why route is very important factor to be considered whenever you want to do, you want to see that there is some toxicity of the drug, toxic effect of the drug. Fourth one is called as a species. Now species also need to prefer. I will also discuss in brief in the coming slides. But I will tell you one thing here, that if you want to check the antiemetic effect of the drug in the rat do not contain CTAT or NTS center. You know that CTAT is a chemo trigger sector zone, which is responsible for the vomiting citizen center, vomiting center is absent in the brain of rat. So that's mean. So whenever you will select any drug, you should know about the species. I will give another example on the rat, that whenever you want to select rat, their gallbladder is fixed, you can say merged with the liver. So that means it is not differentiated. So that means you can not easily imagine about the bile activity in case of rat. The third thing, that rabbit or guinea pig, they do not, you can say, they need a exogenous vitamin C because that is not available in their diet. So that means these are the things which are responsible for the species or age. The next is age, because age also affects the drug effect in the body. Suppose I will give a very simple example to you, that whenever we say a small children having the age of 6 to 12 years, his glomerular filtration rate is more fast as compared to a adult age. And if I will discuss about the old age, the glomerular filtration rate is more slow as compared to the adult age, which is approximately near 80 to 100 ml per minute, which approximately in adult is about 120 to 130 ml per minute, but in small children it can exceed more than 150 ml per minute. So what I can say is also effect. Another is a sex, that means the effect vary in male as well as female. One drug can be safe for the male and same dose can be lethal or toxic for the female. So this can depend upon the enzymatic activity in the body. This can depend upon the total body volume. This can depend upon the BMI in the body, basal metabolic index. Another these four factors which are too much important for the pharmacokinetic and toxicokinetic activity, like absorption. So absorption, you know that absorption depends upon the nature of a substance. That means hydrophilic substance, acidic substance, basic substance, neutral substance, similarly acidic drug, basic drug, neutral drugs, or some antacids. Because absorption is affected by the pH of the gastric solution. Whenever you will see, if you want to take acidic drug and you, in combination with that, you are taking antacid, which will lower the pH and which will interfere with the absorption of acidic drugs. So that's why it is too important to know that whenever you will see that co-absorption is affected in the body. The second factor is called as a metabolism. So metabolism means, I will give you a very simple example, that whenever you will see phenytoin metabolism is affected by phenobarbital, because phenobarbital is an enzyme inducer. So any drug which is an enzyme inducer can increase the metabolism of another drug, and which can lead to lower bioavailability, which can lead to more drug excretion from the body. So that means metabolism, one drug affects the metabolism of the another. Third is called as a distribution. Distribution means it is the mechanism whenever a drug after the metabolism move toward all parts of the body. This is called as a distribution. Now distribution can be affected by a number of factors. Likely it can be affected by protein binding. Likely it can be affected by nature of the drug. Likely it can be affected by the comorbid condition. Suppose if the patient is suffering from kidney failure, liver failure, like that, because in that case the availability of the albumin, globulin, alpha-1 glycoprotein will be less, because there are mostly three types of the drugs which are distributed, either they are acidic, neutral, or basic. In case of acidic drug, they mostly bind with the albumin. The basic drug bind with the globulin. So that means whenever the level of these proteins will be affected, the drug distribution can ultimately be affected and drug will not reach at the cell it indirectly can affect the mechanism and the subtle effect of the drug. So that means the fourth thing is called as an excretion. Now excretion depends upon the glomerular filtration rate. Excretion depends upon the type of substance. Excretion depends upon the volume of distribution of the drug. Because if the drug is having a large volume of distribution, you know that it can take a time to be excreted from the body toward outside. So basically we mostly discuss the T half of the drug because we cannot analyze the full half of the drug. The reason that drug at a minute concentration is excreted can take a long time which cannot be easily analyzed. So that's why we calculate the half time, which is called as a T half. So another is called as a presence of other chemical, presence of food or some other substance in the body. Suppose you know that whenever there will be presence of food can reduce the absorption of the drug. I will give you another example of curcumin because it is commonly used by adding curcumin to a hot milk, little bit hot milk. So that curcumin once you put into a milk contains fat, otherwise curcumin can easily be excreted out from the body because it undergoes first pass metabolism through the hepatoportal vein. So due to how to prevent the first pass metabolism, we always take mostly curcumin either in a milk or with other substances. So that means, dear friends, not only one factor, there can be one drug affect the action of another drug. So this was about the factors which affect the, you can say, drug action or the factor which are responsible for the toxicity. So another go to toxicokinetic because without forming toxicokinetic, we cannot imagine, we cannot analyze the toxic effect of the substance. So it is very important and it is the need of today researchers that they should know about the basic, that what are the animals which are preferred for the toxicokinetic, what are the species which are used for the toxicokinetic, because always students say that how we do toxicokinetic. So I will tell in brief and will give more and more knowledge in the coming slide and in my this lecture that how a person, that how a researcher can go for toxicological analysis by using toxicokinetic method. So dear friends, this is a generation of pharmacokinetic data because always whenever you will take a drug, firstly it exists in your body in a therapeutic range. So that means what I want to say that whenever you will take a drug, it will be in a therapeutic range, which is called as a therapeutic window. So that means if your drug is toxic, this window can be narrow. So that means what I can say, this is called as a narrow window. That means area is less, window is narrow. So what I can say, mostly you read that this is called as a narrow therapeutic index drugs. So they are called as a narrow therapeutic index drug because their window is narrow and they can immediately go from the safe dose to the toxic dose. This is called as a therapeutic index, nothing else. That it is a very simple example I have discussed with you. Another is whenever we go from the safe therapeutic window toward higher level, there is another point which is called as NOAEL, which is called as a no observed adverse effect level, which is a very important parameter for the toxicokinetic analysis. That means you have no observed adverse effect level, no observation. It means you are going in a safe window. But whenever you go beyond the NOAEL, there will be a toxic effect which can be due to a minimum toxic dose or maximum safe dose. So this was the range which is called as a maximum safe dose. So you should know, dear friends, what is exactly the toxin. So that's why they written here that it is the generation of a pharmacokinetic data. Without pharmacokinetic, you cannot go for toxicokinetic. So what I can say, pharmacokinetic is a mother and toxicokinetic is a baby. So that means if you know about the mother, you can know about the baby. So it is important to know. So how you do this? You should design a study, you should conduct a study, you should interpret a study, and you do some safety evaluations. So what you will do here, you will prefer some animals which are called as rodents and non-rodents. I will discuss in brief about the rodent and non-rodent in my separate lecture, and you will easily know that why they are called as a rodent, why they are called as a non-rodent, and how they should be preferred. So dear friends, I will stop my lecture here. So hope this lecture will be very fruitful, and thank you and welcome